Hi guys. I guess this is the first time I have ever been on Instagram. I didn't even know how to do this, but learning something new is good for your brain. So that's a tip. My name is Richard Isaacson, Dr. Isaacson. I am a neurologist by trade, an Alzheimer's prevention neurologist. Whoa, what is that? Whoa, there goes the phone. See, first time on Instagram. Didn't set the phone up right. Anyway, so I'm here to, I guess, answer your questions. And wow, there's been a lot. So please feel free to ask any questions you'd like. Any hard questions? I don't know where Maria Shriver is. I hope she's on vacation, but I'm going to text her if I get any hard questions. But okay, why don't we start off with the first question from Kristen. What is the single most important thing to do to prevent dementia? Oh, man. This is one of those questions that is really hard because there's not like one single magic pill or anything that can prevent or cure Alzheimer's. I wish it was that easy. But I guess what I would say is there's so many things that we can do. So the number one thing to do is to get educated, get informed. Knowledge is power in the fight against Alzheimer's disease. And I honestly believe there are just so many things you can do. So if I had to choose one, now that I've danced around your question, exercise. I mean, exercise is by far the number one thing a person can do to, it loosens up. It basically loosens up the bad protein that gets stuck in the brain called amyloid. This amyloid protein builds up over decades. What most people are unaware of is that Alzheimer's begins in the brain over 20 years, possibly 20 to 30 years or more before that first symptom of memory loss. And that gives us ample time to make brain healthy choices. 1 out of every 3 cases of Alzheimer's may be preventable if that person does everything right. But the problem is several people, a lot of people, they could do everything right and still get Alzheimer's. But number one thing to prevent dementia is to get educated, get informed, learn about what your risk factors are, learn about what your individual things. So if you have high cholesterol, high blood pressure, diabetes alone doubles the risk of Alzheimer's disease. And if you get your blood sugars in check through dietary lifestyle choices, through specific medicines when you see your doctor, these are the types of things. Each person is going to have a different, most important thing to do. Some people it's going to be nutrition. Some people it's going to be getting that blood pressure down. I think most people have not a clue that just by tighter control of your blood pressure, right? So most people say, oh, my blood pressure is borderline, it's okay, it's in the 140s over 80s. Well, guess what? If you get that blood pressure down to the 120s over 70s, a study called the Sprint Mind study showed that if you do that for 3 years, more tighter control of your blood pressure, you can reduce your likelihood of developing the earliest stages of symptomatic Alzheimer's, called mild cognitive impairment, by almost 20%. Stop for a second, wait a minute. Just by tight control of blood pressure? So the key here again is know your numbers, know what your body fat is, know what your highest risk factor is, and then you can do something about it. Okay, wow, I can wave to people on here? How fun is that? I'm gonna try to wave. How do I wave? I'm waving to you and I'm waving to you. This is cool. Hi, Jane, this is fun. Okay, anyway, moving right along. Again, learning something new, never used Instagram before, is good for the brain. You build new connections, you build new backup pathways, learning a new language, learning how to play a musical instrument. I joined a rock band. We're called the Regenerates. We got 99 likes on Facebook, my Miami band. So learning something new is great, but moving right along. Next question from Wild Mountain Honey. What a cool name. Is Alzheimer's a genetic trait that is hereditary? This is a great question. The number one risk factor for Alzheimer's disease is advancing age. So that's the number one risk factor. I think a lot of people think that if you have this gene or a gene of Alzheimer's or multiple family members that you're going to get it, you're doomed. Honestly, that's not true. Genes are not your destiny. You can win the tug of war against your genes. Most people can, not everybody, of course. That's tricky. But the most common gene that's associated with an increased risk of Alzheimer's disease is something called ApoE4. Okay, so just taking a step back so we're all on the same page. ApoE is a gene. It's called apolipoprotein. Not to get complicated, but it's lipoprotein means basically like cholesterol. People with this common Alzheimer's risk gene that you may have heard about called ApoE4. It's a variant called 4, ApoE4. Not just have higher risk of Alzheimer's, but they have higher risk of high cholesterol. So when people have certain genes, those genes can put you in the fast lane to Alzheimer's, and we don't want that. We want you, this is the first time you ever want to be sitting in traffic, right? So certain people with this ApoE4 variant or another Alzheimer's gene out there can kind of push you down the road to Alzheimer's. But genes are not your destiny. If someone has an ApoE4 variant, super common actually, 25% of the population have at least one, it's okay. I know what we're up against. I know what we can do, and there's so many things we can do to fight that gene and make that gene work better for you. So what I would say is in the vast majority of cases, over 90-something%, having a gene or not having a gene is not your destiny. Now, I'm going to take a step back because there are a small number of cases. These are genes that cause early onset Alzheimer's. Now, early onset Alzheimer's disease to me means the onset of symptoms really early. I mean, we're talking like in the late 40s, early 50s, mid 50s. Some people, if you get Alzheimer's symptoms before the age of 65, that can be synonymous with early onset. But these terms are a little tricky. There are certain genes that are deterministic. You get the gene, you get Alzheimer's, less than 1% of cases, like a small minority. So long story short, is Alzheimer's a genetic trait that is hereditary? Sure, you can take a risk gene from a mom or your dad, but genes are not your destiny. We can do things to empower ourselves to make our brain health even better and fight those genes. Okay, next question, Debbie. What is the importance of estrogen and hormone replacement therapy in the prevention of dementia? Oh boy, and the major question, should women be taking HRT or hormone replacement therapy? Okay, so I'm going to slow down a minute here because I think that this is probably among the most important questions that I can think of related to this. So first off, 2 out of every 3 brains affected by Alzheimer's are women's brains. And when I first met actually Maria Shriver about 5-6 years ago, we were doing some TV something or other, and she asked me this question. She was like jabbing me with her elbow, and I said, well, I don't know. Well, I don't know why. I think it's because women live longer. What I can tell you as of today, that is absolutely not the case. There are multiple reasons that women may be in that, again, fast lane to Alzheimer's disease. And the importance of estrogen is something that we really need to talk about. So again, the question was, what is the importance of estrogen and hormone replacement in the prevention of dementia? I truly believe that estrogen may have a protective effect on the brain. However, again, this is not a one-size-fits-all approach. Just like different people have different risk factors that they need to prioritize in an effort to, mitigate or reduce their risk, hormone replacement therapy is something important. So let's talk about risk factors. Women are at higher risk. Why? Not just because they live longer, but I believe that women are at a higher risk of Alzheimer's because of the perimenopause transition. And certain women basically, again, get in that fast lane towards Alzheimer's disease when they start going through the perimenopausal changes. So whether you're in your late 40s, early 50s, mid 50s, whenever these changes start happening, there's something called bioenergetic shifts in the brain. So what the heck does that mean? It basically means that energy metabolism in the brain no longer functions. Just like we age and we get, wrinkles and we get a little slower, the brain ages too. And in women, during the perimenopause transition, the brain can age at a much faster rate. And actually, we just published a study the first author was Neela Rahman, who's super awesome. She was one of our research coordinators in the Alzheimer's prevention clinic at Weill Cornell and New York Presbyterian. The study was led by Lisa Mosconi, also one of the scientific advisors, like me, to the Women's Alzheimer's Movement, who has supported our work and just been so gracious and helpful with helping us understand things. But this study was published literally this week in the Journal of Neurology and showed that, when you compare men versus women, and you look at their brains, they're different. Wow, imagine that. Men and women are different. Well, we looked at their brains and we showed that the perimenopause is actually the strongest risk factor to predict whether or not a person has pathology, brain badness related to Alzheimer's disease. So what we're realizing is that the perimenopause transition and this drop in estrogen during that time can really cause really badness in the brains of women with Alzheimer's. So what is the importance of estrogen? I believe it's a protective hormone. Should we be using hormone replacement therapy? That's an individual decision. This is called doctor's hours. I can't give direct medical advice, but what I can do is say, A, talk to your doctor. B, learn more. When it comes to hormone replacement therapy, it's not one size fits all. There's estrogen. Whoops, there goes the phone again. Sorry, first time on Instagram. There's estrogen, which can be used as a pill, as a patch, or as a cream. So which should you use? It's an individual decision. What dose should you use? That's very important. Always start low and go slow. That's the motto that I usually say. What about, should we check the blood levels of estrogen and titrate it to a specific amount, and then use a little bit of estrogen to start, titrate it up so that the symptoms, perimenopausal symptoms, come down, estrogen levels come up a little bit to a specific level? Well, that would make sense. In our program, we actually monitor cognitive function. So we're not just using estrogen to try to make symptoms better of perimenopause, and we're not just using it to really try to get the estrogen levels in the blood up. We're also trying to see, does replacing estrogen improve memory and other cognitive functions? And that's something that we're studying really closely. However, some people really shouldn't take estrogen. Some women are at a very high risk of breast cancer. Some women who smoke or are obese, they're just at a higher risk of blood clots, and maybe estrogen is not the right thing for them. So this is an individual decision. The other part about estrogen is, when do you start it? How long do you take it for? And these are questions that, if you would have asked me 10 years ago, I would have said, I have absolutely no idea. Talk to the OBGYN. If you would have asked me 5 years ago, I would have said, well, I kind of understand. I think estrogen, maybe estrogen, hormone replacement for 5 to 7 years during the perimenopause transition. I'm pretty sure that's protective if there's no big risk factors. Talk to your OBGYN. Now what I do is I actually talk to the OBGYN myself, and we have a conversation. And the doctor, the OBGYN, says, wow, a neurologist is interested in this. This is great. Let's work together to try to optimize brain health. Because, the answers aren't exactly clear yet. Should a woman be taking hormone replacement therapy? I think if I had to shake the 8-ball, remember those 8 balls? Am I dating myself? The answer points to yes. I think hormone replacement therapy it's more likely than not that it can be protective, but the key here is not in everybody. Should it be a patch? Should it be a cream? Maybe it's better than a pill, because when you take a pill, it affects the whole body. When you use a cream, maybe the absorption can be controlled more. These are questions that really just, unfortunately, don't have the perfect answers yet, so it's critical to talk to your doctor. And I know I spent a lot of time on that question, but this is a really important question. There's other aspects, like, should I be on progesterone? Should I just start progesterone first? Well, maybe not. Maybe progesterone's not protective, but maybe progesterone is the right thing for you at the time. So these are really confusing things, and whether you have a uterus or not, you may need progesterone, or you shouldn't take progesterone. So these are questions you have to talk to your doctor about. The other important thing is, when it comes to like a hysterectomy, the study we just published in the Journal of Neurology, there's something called surgical menopause. Surgical menopause means that when you take out the uterus, you also can sometimes they take out the ovaries too. And 20 years ago, they commonly did this. Well, that falling off a cliff of estrogen where the ovaries are now out and the estrogen is gone, and then if that estrogen doesn't get replaced, that worries me. I've really been worried about that now that we've looked at the data. So long story short, this is a complicated topic, and I could literally talk for hours on this. How long do I get? Do I get like 2-3 hours to talk about this? No, I'm just kidding. I think I get like 20 minutes. So I will move on to the next question. Okay, to tack on to that question, how do women balance, let me see. Sorry, I'm bad at Instagram. How do women balance breast health, and brain health regard to hormone replacement therapy? Okay, so I touched on this a little bit. This is a really tricky question. This is, if someone has a strong family history of breast cancer, you have to be careful, and you have to watch the dose, and you have to have screening mammograms, and you need to know what your genetics are maybe for risk. So again, talk to your doctor, talk to your OBGYN, and try to figure this out. Okay, next question. My mom has dementia. I'm very sorry. I have 4 family members with Alzheimer's. I hate this disease. This disease is like the worst, but we're making progress. I'm more hopeful now than ever. My mom has dementia. She was a Dutch immigrant different. Led a very stressful, poor to riches life. What steps can I take to lessen my risk? So, oh boy, stress. Okay. I'll be very frank and honest. When I went to medical school, I don't know, I was very skeptical that this whole relationship of stress had like anything to do with anything. I'm like, whatever, just take a deep breath. I was dead wrong. Stress is an absolute. Oh, there goes the phone again. I'm sorry. I need a phone stand. Wait, I'm gonna wait. Can I wave to some people? I'm gonna wave. Hey, how you doing? Hi, how's it going? So stress is bad. Take a deep breath. Minimize stress. Stress will fast forward Alzheimer's. And let's talk about this in detail. I have a woman that I take care of. She's like the sweetest person in the world. She has a PhD in mathematics, okay? She is like genius level talent. That's what Jay-Z would say. She's like amazing. And when she started having Alzheimer's symptoms, she was like 59, 60, 61. But how does that make any sense? Her whole family, her mom and her grandmother and several family members all got Alzheimer's in their 70s. Why on earth would she start having symptoms, at 60 something when everyone else in the family was 70? Well, she lived the most stressful life imaginable. She was in a terrible relationship. She had a serious work issue. She had monetary problems growing up. Stress absolutely fast-forwarded Alzheimer's. It didn't cause it per se, but it fast-forwarded. The other thing about stress is not all stress is created equal. Depression, especially mild depression, early life and really midlife, is a risk factor for Alzheimer's. Anxiety is probably not good for brain health either. But the number one thing that you can learn today, and this is a study that literally just came out in the last 2 or 3 weeks, is that there's a specific type of stress, worry or rumination. When someone ruminates and just thinks about something over and over and over again, guess what? It's tied to poorer cognitive health and also a smaller memory center in the brain called the hippocampus. Like why do you want to shrink your brain? That's not a good thing. So if you're worrying or if you're ruminating, take a step back and say, how can I do something to be proactive and fight this? Do I need to take some deep breaths? Should I try meditation? If you're interested in meditation, look up this guy. This guy is like the coolest on the planet. His name is Bob Roth. He's the CEO of the David Lynch Foundation. Big shout out. Transcendental meditation has been studied in so many different studies. Transcendental meditation or other types of whatever works for you meditation or whatever works for you is something I'd absolutely recommend. Mindfulness-based stress reduction, tons of evidence about protecting brain health. You have to do something. And the worst part about worry and rumination is repetitive negative thinking. If you are a repetitive negative thinker, that is the absolute number one worst possible thing that someone can do, that a woman can do for their brain health. Why? Because it actually fast forwards amyloid and tau, the bad proteins that get built up in the brain. Study came out for the first time about 2 weeks ago, showed that literally repetitive negative thinking absolutely just completely fast forwards badness of brain aging and also Alzheimer's. So what steps can you do? Take a deep breath and again, learn about all the different risk factors that you have and try to address it. Okay, next question. So many questions. Does brain atrophy mean that a person will most likely have dementia as they age? That's a good question. I'm not super excited about when a person has brain shrinkage, but I don't know that it's always really possible to really definitively say that someone with a smaller brain or shrinkage that looks like shrinkage is truly going to be on the road to dementia. I think something that most people are unaware of is that people can have amyloid in their brain, the bad protein that gets gunked up, as someone develops Alzheimer's dementia. At least a third, and it depends on which study you choose, but say 30% of people that have amyloid in their brain don't have cognitive symptoms and actually may pass away and not have dementia. And this is confusing because you say, well, what does that mean? You have amyloid. Well, you can also build better brain backup pathways, a higher cognitive reserve. If you know how to handle stress and you can have compensatory mechanisms, you can withstand that amyloid onset. If you exercise on a regular basis, minimum 150 minutes a week, a mix of high-intensity interval training, strength training, you need a personalized and exercise plan for you. These are all these different types of interventions that can protect you from developing dementia, even though someone has some brain shrinkage and even though someone has the buildup of amyloid in their brain. Okay, next question. Lots of questions. Keep coming. My mother was diagnosed with Alzheimer's. Again, I'm very sorry, but passed away due to bone cancer. I think my father also had dementia before he died of a heart attack. Okay, so some cardiovascular disease, maybe vascular dementia. I'm not really sure what to say about that. But can you advise what the statistics are that children of Alzheimer's patients will also contract the disease? This is a tricky one. I guess what I would say is, again, genes are not your destiny. You can win the tug of war against your genes. It depends. If someone has multiple family members with Alzheimer's, sure, they certainly could be at a higher risk. But also, maybe that person had a gene, maybe your family member had a gene, and you didn't get that gene. Well, then, guess what? You're at a lower risk because you didn't get that gene. Now, in most cases, we don't know if you got the gene or not. But I guess what I would say is everyone with a brain is at risk for Alzheimer's disease, because it's such a common disease. At the age of 85, over 40% of people will have some sort of, Alzheimer's type symptoms. That's striking. So what I recommend is don't worry about statistics. Don't worry about, getting really worked up about being at such a high risk. Just take a step back and say, I can do something. I'm going to grab the bull by the horns. I'm going to take control of my brain health, and I'm going to get educated and get informed. There are pharmacologic, meaning drugs, vitamins, and supplements that you can think about in terms of reducing risk. And then there are non-pharmacologic, non-drug approaches: exercise, stress reduction, sleep. Wow, we should really talk about sleep because it's important. People that are burning the candle at both ends, like you're just, again, fast forwarding straight away to Alzheimer's, which is just like no bueno. So you take all these different things. A lot of people have high cholesterol, fast forwarding towards Alzheimer's. A lot of people, don't have enough brain healthy fats. The most brain healthy fat out there is omega-3 fatty acids. Some people just call those fish oils, and that's okay. It's kind of a misnomer. The fish eat the algae. The algae is a plant-based omega-3. That fat gets eaten by the fish, and then people eat the fish. So some people are omega-3 fatty acid deficient, and that may play a role in Alzheimer's risk. So these are all different things. Each person needs to figure out their own individual risk factors and address them head on. Okay, I see a question here. Does long-term use of medication for depression, anxiety contribute to Alzheimer's or cognitive decline? It's a question from Judy. Thanks, Judy. That's a great question. Great question, because I don't know that we know for sure. But if I had to use my clinical opinion based on seeing, several thousand patients with dementia and, almost 1,000 patients for specifically to try to reduce their risk for dementia in the Alzheimer's Prevention Clinic, I would say that if someone is using medications like SSRIs, selective serotonin reuptake inhibitors, if someone has mild depression and they're being treated for depression with a selective serotonin uptake inhibitor, SSRI, I absolutely think that's a great idea. I mean, is it protective? I can't say I know for sure, but maybe. I think there's some research to suggest there could be some protective properties. First of all, if someone is stressed out and depressed and anxious, again, that's going to fast forward brain aging. I'm an advocate. I mean, I'm not pro drug. I'm not pro vitamin. I'm not pro supplement. I'm pro evidence. If there's evidence for something, I would absolutely recommend it. And SSRIs, I think, are great. I am getting a request. Send a request to be someone would like to join the video. I hope I'm doing something right. I am go live. Okay, Aaron. How are you, Aaron? Come on in. I'm waiting for Erin, my old friend, BFF. Where are you, Erin? Come on in. Hey, there she is. Erin, did you want to join?
Oh my God!
You asked to join. Did
No,
you not want to? I see your
sorry.
feet. Those are great shoes. Oh, Erin, you didn't want. Oh, you missed me. That's a great. Oh, there she goes. Well, I like your purse, Erin. Erin wanted to join. I let her join. That's cool. Erin's great. Sandy, you want to join too? Someone else wants to come on in. Samir wants to join. This guy, if anyone wants to join. join. Like, come on in. Okay. I think that was non-intentional. You confused me there. I'm an Instagram. Let me say rookie. Let me just say rookie. I've never done this before. It's my first time. So I don't know if I should have just let some random person named Aaron in, but it was cool. I enjoyed that. That was weird. Okay. Does anyone else have any questions? I think I was supposed to do this for like 20, 25 minutes. We're at 25. I can take another question. Otherwise I can wrap up. I'm flexible, easy. You are doing great without me. Hey, Aaron, you're the wind beneath my wings, but thanks for joining. It was great to see your feet. It was great. It was great. I like your sunglasses. Those were cool. Going down the highway. Was that Pacific Coast Highway? I don't know. I'm guessing. Okay. So with that, I guess I am out of questions and I'm out of time. It was great. Thanks so much for always for being here. If you want to learn more, check out the Women's Alzheimer's Movement website. There is like so much information there. I actually helped a little bit, maybe more than a little bit. No, I did just a tiny little bit on this brain health tips pamphlet that was pretty cool. So hopefully you can get some information there. If you'd like to learn more, we have a free website. If you want to learn, we have several courses about Alzheimer's disease, totally free. It's at a place called alzu.org, totally free. And if you want to learn more, just I don't know, get educated, get informed, know your numbers. That's what I'm going to leave with. If you want to learn more, the best way to learn more is learn about yourself. Everyone watching needs to know their blood pressure, their fasting blood sugar, their cholesterol, their all sorts of things. They should know their body fat. They should know their resting heart rate. They should know all these numbers because these are numbers that influence Alzheimer's risk. Don't be fearful. Fear is paralyzing. Get to know your numbers. Do something about it if they're, a little bit off kilter, and we got this. Thanks so much, everyone. I have no idea how to end this, so I'm just going to press some random buttons. Aaron, you want to come back? You can help me figure that out. Thanks, guys. Pleasure.